Employees at long-term care facilities are among the first in Oregon to get the COVID-19 vaccine, and this morning we're getting a closer look at what that experience may be like.
Some of the first facilities who have received the vaccine include the Avamere family of companies. Joining us live to tell us how the rollout is going so far for them, Chief Medical Officer Dr. Elizabeth Burns. Good morning. Thanks for being here.
Good morning, and thank you for having me.
Yeah, so I would imagine it has been a very busy week here in the lead up to Christmas. How has this rollout been at your facilities?
Yeah, this is actually a very exciting week for Oregon, right? And especially in long-term care for our staff and our seniors. As many of you are aware, Oregon received about 37,000 doses of the Pfizer vaccine over the weekend, and we're anticipating another 25,000 this week. And I just want to thank Governor Brown for working with hospitals and with us in the long-term care sector, prioritizing long-term care and healthcare workers in the phase 1 distribution. We are participating with the federal pharmacy program. And as you're aware, it's a very complex operational process. So we're working with the state and our pharmacy partners, really walking lockstep together in the deployment of our facilities. So the distribution pipeline is determined by the state. And so we have preparedness plans and a lot of enthusiasm surrounding our ability to protect our seniors in the days, weeks, and months to come. In fact, I had the opportunity to be vaccinated yesterday, and I was really encouraged how seamless the deployment went.
Oh, very good. And it looks like you are feeling fine and doing well here.
I'm actually feeling great today. Just a little bit of soreness in my arm, but other than that, I'm feeling wonderful.
From your office window there at Trillium Lake with Mount Hood in the background, very nice there. Hey, would you do us a favor and just sort of reemphasize the importance of why these shots are important to either you or somebody who may be a little bit older in your family pod?
You bet. So we know that vulnerable populations have been the casualty of this pandemic, right? And age is the single most important predictor of severe COVID-19. And while getting vaccinated is a personal choice, it's important to remember that this vaccine represents a vital tool in our arsenal against COVID-19. We really live in this remarkable age of science and technology that's delivered us this highly effective vaccine. But science really cannot get us out of this pandemic. It's our personal choices as we move forward that really dictate the months, ahead of us. And so I really want everybody to get educated with reliable information, right? Not only are we combating COVID, we're combating misinformation about the vaccine itself. And so it's important to know it's going to take about 3 out of every 4 people to really make an impact by adding this vaccine to our arsenal. And during that time, we also want to make sure that we're practicing socially distancing, hand hygiene, and covering our mouth and our nose. We know that after the vaccine has been distributed, it takes 2 doses, right? And so after the first dose, you do deliver some immunity at about 7 days out. And 3 to 4 weeks later, depending upon which vaccine you get, 7 days after that, you'll have optimal immunity. So really, over the course of the next 2 months, we're walking through some of the most difficult times during this pandemic. Case counts are rising, and while we have hope on the horizon, we all have to practice public health measures to make this vaccine effective and be able to decrease the amount of community transmission.
Well, Dr. Burns, I think there are probably so many people who are watching these first vaccines going out to senior living facilities and wondering when are they going to get to see their loved ones again? I know, my family doesn't get to spend Christmas with my grandmother in person this year. So what do you want the families, the loved ones of people at your facilities to know about this next year? When might they be able to be in person again?
Yeah, that's a great question, right? And that's top of mind for all of us, not only our communities, but all of us, right? In society, we've all been impacted by this pandemic, but it will take all of us to be able to make communities reopening, schools reopening, public places to reopen, something that we all have to do together. We have to all really pitch in, get vaccinated, continue to, again, implement public health measures so we can decrease the amount of community spread and get back to what we once remember as, a normal life where we're all coming back together. So it's really our behavior that will dictate when we can reopen safely.
So no timeline just yet about when some of those procedures at facilities might be changing, just too far down the pipeline for that right now?
It is because we know that community, right, test positivity is a reflection of what can happen within our facilities.
Right.
So when the community at large, right, has high, community transmission, we really need to safeguard our patients and protect them. And
Sure.
so, unfortunately, the best measures at this point in time is really keeping, your social circle closed. Everybody has to continue to remain in that bubble until we can get the community transmission down.
It is that group effort. All right, Dr. Burns, thank you for joining us this morning. We appreciate your time and happy holidays to you.
Thank you, and likewise to you.
Yeah.